This is a 45-year-old female with a history of hypertension and end-stage renal disease on dialysis. CHF who underwent a total abdominal hysterectomy. No known drug allergies. I got another one coming down to R14. Okay, tell me about him. Yeah. Uh-huh. I'll be down as soon as I can. Sorry, so what was I?
CHF?
Yes, CHF, end-stage renal disease, uneventful course. She's comfortable though, did great. Gotta run. I'll write all the numbers on the board before I run out.
Okay. Hey, Doc. I noticed her pressure was a little low, 90/50. What do you think about that? I mean, was that going on in the OR?
I don't know. Is the anesthesia resident still around?
No, he's gone.
Well, let's just bolus her with fluids and see what happens.
But remember, she has renal failure and heart failure.
This is a 45-year-old female with a history of ESRD on dialysis, hypertension, CHF, who underwent a total abdominal hysterectomy. No known drug allergies. She got general anesthesia with an endotracheal tube, was paralyzed and reversed at the end of the case. Intra-op course, uneventful. She got cefacilin and metronidazole. For pain control, she received 2 milligrams of hydromophone throughout the case, so seems to be comfortable. Do you have any questions?
Well, I noticed her pressure was a little low, 90/50. So are you dealing with hypotension in this case?
A little bit. Her baseline pressure coming in was 100/60, but she was just dialyzed this morning, so I wasn't too concerned. But I would be cautious with fluid boluses given her heart failure and renal disease. In OR, she did respond to small 250 cc fluid boluses, so I would try that first.
Okay, thanks. Let's hang 250 cc of normal saline then.
Okay.
Hey, how's it going? Just got finished putting in the chest tube on Miss McGinley and was going to head out for the night. Let's run the list and make sure we're all set for tomorrow.
Sure, sounds good. Okay, Mr. Tyne on Rhodes is tenuous. That's why he's getting the CT scan to see what's going on with his abdominal pain. Miss McGinley, you know about. Do you want me to put in an order for a PCA for the pain?
Yeah, that'd be great.
And then there's Miss Manning. Hello?
Dr. Chang, I'm out here at bedside with Mr. Tyne. He's going downstairs to have his CT scan. His family's up here and they have all sorts of questions about his operation and why he's going in for a scan. He just pulled off his telemetry and I don't know what to do. Can you come up here and speak to his family?
Yeah, I'm going over the list with my chief right now, so it'll probably be a while. When can I talk with him? I have no idea. Maybe an hour or two? Just please, get him down there for the scan.
What was that all about?
You don't even want to know. I think the nurse is more anxious than the patient. I'll deal with it later. Hello, this is Dr. Chang from GI Surgery.
Dr. Chang, I'm out here at bedside with Mr. Tyne. He's going downstairs to have his CT scan. His family's up here and they have all sorts of questions about his operation and why he's going in for a scan. He just pulled off his telemetry and I don't know what to do. Can you come up here and speak to his family?
I'm with my chief right now. We were just talking about him. We're concerned too, which is why he's getting the CT scan. When can I talk with him? Okay, let's get a new set of vital signs and please let the family know that I'll be down in 30 minutes. And please, call me if anything changes.
What was that all about?
Mr. Tyne's family just arrived, and they have a lot of questions. And it seems like he's getting a little delirious.
I'm sure. His surgery was fairly difficult. Why don't I go talk with them after we're done here? They may want to talk with the attending on the phone anyway, and I'll be able to call him easily. It'll be quicker, and this way you can stay here and finish up your work.
That would be amazing. Thank you.
Also, please make sure to call me with the CT results and call me with anything else, no matter what time.
Sure, no problem.
Hi, are you taking care of Mr. Gerald Haynes?
Yeah.
Great. This is Mike with radiology. I just wanted to let you know that I was taking a look at his CT scan, and he has a small bowel obstruction and the transition points in the distal jejunum. I don't see any masses or abnormal fluid collections. and the rest of the abdominal organs look normal.
Okay, got it.
And what is your name again? Hello?
Oh my God, can I ever get any work done in peace? Of course he had a small bowel obstruction. I could have diagnosed that from the edge of the bed. Hello, this is Dr. Chang from GI Surgery.
Hi, are you taking care of Mr. Gerald Haynes?
Yes, I am.
Great. This is Mike with radiology. I just wanted to let you know that I was taking a look at his CT scan, and he has a small bowel obstruction and the transition points in the distal jejunum. I don't see any masses or abnormal fluid collections, and the rest of the abdominal organs look normal. And what is your name again?
Grace Chang. I'm the senior resident for GI Surgery. Well, let me write that down and read it back to you. Mr. Haynes, small bowel obstruction with a probable jejunum transition point. Anything else?
Well, there was one more question I had for you. Does the patient have heart failure?
Not that I know of. Why?
Just because I see large bilateral pleural effusions.
Okay. Good to know. Anything else?
Nope, that's it.
Thanks.
Surgical rapid response to Rose 1. Adult surgical rapid response to Rose 1.
Well, that was certainly unexpected.
Yeah, tell me about it. He seemed completely fine after the OR this afternoon.
Well, at least he seems to be doing better now. For a minute there, I thought we might have to intubate him. Is there anything else we need to do? Should we call the attending?
Nah, he's doing better. And I doubt Dr. Myers would want to be bothered this time of night. She's probably sleeping.
Well, at least he seems to be doing better now. For a minute there, I thought we might have to intubate him. Is there anything else we need to do? Should we call the attending?
Yes, thanks for reminding me. Hi, Dr. Myers. This is Grace Chang.
Hi, Grace. Yeah, what's going on?
I'm so sorry to be calling you this late at night, but I wanted to let you know that Mr. Ramirez just rapid responded on server 12.
Okay, thanks. Yeah, I didn't see that coming either.
We think it was all post-op pulmonary edema. You know, he had a history of cardiac issues. He's looking good now that we've given him 40 furosemide and some nebs.
Sounds like everything's under control now. And hey, just so you know, I appreciate the call, even at this late hour. You know what? We should probably think about a cardiology consult to help us with his heart failure management in the morning.
Okay, I added it to our list to discuss in the morning when we see him. Have a good night.